So yes, so STAMPEDE, as I think probably most of the audience would like to know, is a multi-arm trial. So we set out to look at a range of different treatments in men starting long-term hormone therapy for the first time as the broad thing we wanted to do. And broadly, what we're aiming to identify is treatments that will improve survival substantially. So typically, a drug that improves survival in the end stage will have a hazard ratio in that setting compared to control of 0.75 or so. So if you look at the abiraterone trials, the enzalutamide trials, the docetaxel trials, they all hit a hazard ratio of about 0.75, which translates into a survival gain of 3-4 months, which is obviously in the context of a 70+ year lifespan is quite trivial, really. And obviously that's not to play down the importance of that. What we were hoping to demonstrate with STAMPEDE was that if you took an active agent, and the first one we showed this with was docetaxel, and preserve that hazard ratio, but you're bolting a 25% control arm survival of 3 years, you're then looking at a delta of years, maybe a couple of years. And so that was the broad underlying principle of STAMPEDE, and what we have demonstrated now is a number of treatments: docetaxel, radiotherapy in low volume disease, and abiraterone improves survival by durations in years. Now, coming back to the results we just presented, we previously presented the abiraterone data in 2017. At that point, the gap between the curves was huge, so we were actually able to analyse relatively early because we had the events that we needed. But what we didn't have at that point is any clarity as to what happened at the median duration of survival, for example, what happened 6-7 years out, how long people were going to end up on abiraterone for, particularly with lower volume disease. And also because the Latitude trial only had high-risk patients in it, there's obviously a very relevant question of, does abiraterone work just as well in low-risk patients? So those were the things we set out to answer.